Dr. Thorning, I'm not sure I got the end of your testimony exactly right, and I tried to find the language you used in your written testimony. I didn't see it. But it sounded like your recommendation for parents of a child suffering from asthma is that the parents get a job. What would you tell the parents of the 25,000 Rhode Island kids who have asthma, who have jobs already, about what we could be doing to help their kids not have to face these bad air days that keep them indoors, not have to have the emergency room visits that Dr. Ginda has referred to at Kent County Hospital?
Senator, I think the thought I'm trying to get across is that we need to focus on trying to restart the American economy and get job growth going, because as the chart that Senator Inhofe showed, Senator Barrasso showed, poverty is has the most significant impact on children's health.
But what about a child who's not in poverty?
Well,
children get asthma who aren't in poverty. Children get asthma whose parents work. What do you do for them? They're in the hospital too. They're part of that 25,000.
I think we need to take care as we look at these existing regulations and future regulations to be sure that the benefits equal the costs. And it's pretty clear that the benefits EPA has alleged that stem from this Clean Air Act amendments are substantially overstated. We need to balance everything and look at how that impacts.
How do you value the cost of a mom who has to spend 2 days in the hospital, as Dr. Ginda suggested is the average length of stay for somebody admitted for asthma? Where's that priced in your calculus?
I just refer to the economic calculations that EPA produced with their macroeconomic SIMs that shows that the overall benefits, even when you factor in stronger health benefits in their case, which is the red bars in my chart, you show negative impacts on GDP. Every decrease in GDP means fewer jobs.
I get the larger point,
lower income.
How does the mom who's spending 2 days in the hospital worrying about her infant, where's the cost of that factor into your calculation?
Well,
that's what I don't see.
That is certainly a cost to the individual family.
Senator Whitehouse, may I add something to that?
Of course.
Thank you. There is evidence, we know that the children in poverty have higher rates of asthma. And there is evidence that the reason for that is that those children are living in areas of higher air pollution. They live closer to busy roads. They live closer to industrial plumes. And it's not the poverty itself, except that the poverty is what keeps them living in areas of high air pollution.
Mr. Resnick, is there any doubt in your mind that there's a correlation between exposure to air pollution and asthma?
My experience as a respiratory therapist is that there are many different triggers of asthma, and air pollution certainly is one of those triggers.